Hello, everyone. This is Central Health Grenada's special online broadcast entitled COVID-19 and Those Most at Risk. My name is Roslyn Douglas. I'm the founder of Central Health Grenada. And today we are fortunate to have a social worker with us today, Melisse Ogilvie. She got her master's degree in social work from Stephen F. Austin State University. And I want to thank you so much. We're under curfew, so we're doing this via Zoom on the first day of April. How are you, Melisse?
I'm fine, thank you. Thank you for having me.
Thanks for accepting. So first, before we get into just a brief conversation about how COVID-19 could affect families, first tell us about the field of social work. Can you explain what that is?
Well, social work is a really dynamic field. You can find social workers in different spheres of in business. You can find social workers in the hospital. You find social workers in Grenada. We find social workers in mental health. We have social workers who operate through the Ministry of Social Development and in child protection and so forth. So social workers are trained. We call ourselves generalists. Some are more specialized. So we have maybe the clinical social workers who are mostly counselors. And then we have school social workers who are trained to work within the school environment and the issues that may come up for school children. But mostly the generalist social workers are trained to work with a variety of clientele, but that clientele and a variety of issues. So we're not experts in one, but we are able to transfer skills across issues.
In your day-to-day career, you focus on families and children. And so that leads to my first question, which is, how can COVID-19 affect families at this time from the perspective of a social worker?
Well, COVID-19 has and will affect everyone, right? We may not be the ones to physically contract the virus, but we have to deal with the repercussions. The first and foremost, the government, well, it's not really an imposition, it's really a measure to protect us. Mm-hmm. So we're dealing with the curfew. We're under curfew at this point where we are told to stay at home, right? And persons may struggle with that for a bit because it's almost like you've lost control of your activities. Mm-hmm. So as going to the shops. So these things are managed. Those activities are managed for you. We have children who are at home from school and they are homeschooled. Parents are expected to support them to complete the curriculum. Teachers provide the resources and the parents are supposed to help. And now that may cause some anxiety and some stress for parents because especially if you have a child doing math and that's not an area you're comfortable or you're knowledgeable of and you're still expected to help your child, that may cause you some stress. And then the fear of contracting the virus is real for many people. And that may impact our moods in a variety of ways, even for children, because they're around when conversations are held and discussions are held about, and it's human nature to talk about the negatives. So we are speaking about the number of people who have succumbed to the illness, but we're not speaking about the number of persons who have survived the illnesses. And so for children, they are going to be fixated, and adults too are fixated on the negative outcomes, but we're not fixated on the positive. And so all of that affects us, and the persons who have lost their livelihoods as well. And so there's a real concern about being able to provide for the physical needs of your family. So you're present, physically present now. You're forced to be physically present now, but really and truly, you may be concerned about, okay, the bills are due next month. How are we going to do that? How are we going to pay? How are we going to feed our children? We weren't able to maybe stand in the long lines because we're working, right?
And that's
And
a real thing. That's a real thing.
is real. And so, and also persons who may, have coping strategies such as going to the gym or attending church and church activities. And this is no longer available to you as a coping strategy. You have to find an alternative, or that is going to cause you some stress. So families.
So what, let me ask you this, then what alternatives can a family do together? Because I'm so happy that you mentioned that. People have on their regular day, they have various coping strategies. Like you said, going to the gym, maybe going for a walk, but during, at least for the next 7 days, and hopefully it won't be extended for a further 7, what can families do together?
Well, we need to, first of all, let's look at the positive, right? First of all, look at it as an experience. It, I know it's much more difficult to do, but if we think of it, this is an opportunity for us to have meaningful relationship with our families, and also engage in meaningful activities. So one, you can still play hopscotch or skip in the yard. Many of our young people do not know how to play skip and don't know about skip and hopscotch. So those are some of the things that you can do. Card games, board games, right? Sit to watch television, watch a nice movie together, and discuss it after. Bake cookies with your children. Have date nights at home with your husband, right? And because and you never know what you will discover about the other person by just intentionally making this time something that's going to be positive. And also, look at the positives in everything. Every day, look for something to be grateful for. Because we have a lot of things that we can complain about. But if by looking for the positives and being grateful for certain things, then we are shifting our mindset, right? And then and hopefully this will make a huge difference in how we get through this.
Another question for you, it's something that you would have mentioned in terms of, we need to be careful for those who have children, how we are talking about the situation. And it brings to mind a personal experience of having young relatives at the time, and this was after Ivan. And one of them said to me, oh, why does God hate Grenada? Why did he do this? Like, why did he send a hurricane for us? And in their little itty bitty minds, they just had, that's what they heard, and that's their interpretation of it. And so I took the opportunity for a teaching moment to show them how hurricanes are formed, how the wind comes off of the African coast and how it kind of twirls around and what time of the year. And so how sometimes it misses Grenada, but then sometimes it can happen. And then, it just created a greater appreciation for what's happening. So having said that, what are some ways that parents can speak to their young children about COVID-19 and being mindful not to freak out, being mindful not to say their fears out loud, knowing that their child could absorb it?
Right. First and foremost, we must acknowledge our own fears, right? And also that of our children. And it's okay to say, mommy is also scared, right? But this is what we're thinking about. And we have to also be child focused in all things that we do, how our conversations must be at their level. Now, a child might be afraid or might hear certain things. Tell them the facts, but bits and pieces of the facts. I'm not telling you to lie to them, but give them the information. Yes, some people die, because they would have seen it on the news. They would have heard you talking about it. So yes, but more people have survived this, right? Some people may show symptoms, others may not. Does that mean that we don't, mommy and daddy are here for you or love you any different if you're scared? No, we're not. We don't. Our feelings for you have not changed. And so one of the things that we have to be real, and sometimes for us it's uncomfortable talking about feelings, right? In our culture, we're not. Yes, we have it, and we assume our children know how we feel about them, but sometimes they don't. If you have not, you may need to communicate it to them. So in this period, that might be a way to learn how to, and that how to communicate our feelings, and also have your children feel safe to communicate their feelings. And one of the things for children, and for adults too, anxiety, fear may not, may, we may not be able to articulate it, but we may feel it in our bodies. For children, they may tell you their tummies hurt. And it might not be that they need Pepto-Bismol, but it just means that they are experiencing some symptoms of anxiety and fear in their bodies.
Absolutely.
And so we have to recognize that. We also have to be really compassionate and patient. And I know they are probably in your feet all day asking a lot of questions about a variety of different things, want to go outside, can't understand why they can't go outside, and all of those things. And it's a pain sometimes and stressful for you because you also have to deal with other things. But be patient and recognize that also they are, for children in particular, they are also that you are going to be feeling.
So in this time, in this era, we're going through prevention. That's what families are doing right now. We are in compliance with what the Ministry of Health is asking us, and it's not unique to Grenada. Even on this date, St. Lucia is under a curfew, and we have other countries around the world that have also some type of restriction and movements and when you can shop. Because even now in Grenada, we have Monday, Wednesday, and Friday as shopping days and specific hours within our parish. It's that serious. So us being at home as a family, we are trying to prevent the spread of it or prevent us from contracting it. And then we're at home. And then you also spoke about people's livelihood being affected by this. People who work day to day or by the hour, they're not salaried where they're at home and they're still being paid. If they don't work, they don't eat, and that's additional stress. I guess what I would like you to speak on as we wrap up would be the impact of COVID-19 on the elderly. Can you speak on that from the perspective of a social worker? Any concerns you would have about that group?
You know, we saw pictures on Facebook of the elderly going to supermarkets and the shelves are empty. And that concerns me. It hurts me, specifically because I also I live with my 91-year-old great aunt, right? And I can't imagine her at this stage. I mean, she's quite mobile and can do most things for herself. But I can't imagine her at this stage going to the supermarket and having to stand in line or having, needing something as a can of soup and it's not being available because persons have hoarded it, they've shopped beyond what they need. So our elderly in our communities are affected. And so we need to look in on them. Now, they might be worried about how they are going to take care of themselves. If they fall ill at home, who in this time of social distancing, how are they going to notify someone that they are unwell and they need maybe someone to help them make their meals, right? I know Ministry of Social Development, the desk of the elderly are considering the needs of our elderly, but I'm sure they're not going to be able to reach everyone. So it's the onus is on us to think about the persons in our communities who may not be able to make provisions for themselves, right? We also have to be mindful in this time, persons, we're indoors, and some of us may be suffering from mental illness, typically depression as a starting point, and we have very many stages of depression. And so being isolated from others may actually compound that. And so we have to make sure that we look out and we reach out to our friends and families and even the elderly, because they may be because that stage of development, really, they are going through that phase where they're getting old and they're losing control of their lives and decision making, and maybe the ability to hear, and they become incontinent and those sort of things, and that brings on depression in the elderly.
Mm.
And so this season, this era, as you call it, is likely to compound that, how they navigate this stage of life. Similarly for our children, right? They might be living in homes where emotionally present, and there might be some neglect and maybe even some abuse, physical and abuse, and schools are the safe haven for them. And so we as educators and social workers so have to be prepared that when schools are reopened, that there might be some more not referrals, not the word I want, but anyway, there might be an increase
Need for
in
services.
yes, and so and in the cases of abuse, because and some parents maybe before COVID they were a what we say a good enough, they provided their children with good enough parenting, but this season has impacted them so much that there might be an incident where they lash out at their own child, not intentionally, but because they are frustrated and because they are under stress and have become irritable, and there's anger. Maybe angry at the government, maybe angry at the people who came into Grenada knowing that they pose a risk to us, and they may be angry at their employers or for different reasons. So those are some of the things that we need to be prepared for.
Wow, that's really powerful. Well, thank you so much for joining us today on Central Health Grenada's special online broadcast entitled COVID-19 and Those Most at Risk. The conversation was really, really a nice 360 of everyone who could be impacted by the families. We are trying to do some prevention. You did discuss livelihood. You spoke about how the elderly could be impacted by this and those who have mental illness. And I guess as we wrap up, I would say if you're stressed out, please do not take it out on your child. If you're living with someone who is up in age and you're frustrated, please do not abuse them. So we will have to keep all those matters in prayer. So thank you so much, Ms. Melisse Ogilvie, who has a master's degree in social work. Thank you so much for joining us today.
Thank you for having me again. Take care.